The thing about hope is knowing, believing that there is help. I get emotional because I didn't feel good. And because of me switching to the Humana insurance, there is an opportunity for you to do better. And this is what I got.
Mr. McCoy's story is such a perfect example of when the healthcare system works well. There's a very famous prescription that was written by one of our founders many years ago that said people before paper. When you see it, in his life, you realize that's how it all comes together, that we're really removing barriers. We're giving him the opportunity to have the best health potential that he can have, and we do it over and over and over and over again for millions of people.
I met Mr. McCoy at a church function that we did in the Hiram Clark community, and it was just talking about CenterWell and getting all of the seniors together for them to really understand who we are, what we do, and how we could really partner with the community. And he was one of the very first people who approached me afterwards and said, "Tell me more. I want to learn more about CenterWell because I've lost faith in our healthcare system."
I've had diabetes for over 20 years. And because of the hopelessness, I felt like it doesn't matter what I eat. It doesn't matter what I drink. It doesn't matter.
I met Reverend McCoy, and he was in the hospital. The doctors were talking about amputating and cutting off both his legs. And wow, and it was a real sad moment.
When she gave that presentation, I felt excited. I felt like there was hope for me. I had to go and see what they had to offer.
So how CenterWell helped Mr. McCoy in his healthcare journey is quite a story. So diabetes is something that we hear a lot about. I'm sure you can turn on the television and hear about diabetes and different medications, but it's very serious. And so if it goes untreated, it can be life-threatening. And so for Mr. McCoy, that was the situation. His A1C, I want to say, which was his blood sugars, were about 13.5. And they came down to, I want to say, I think it was within a 2-month period of time to underneath 9, which is just miraculous because he really partnered with not only our physician, but our pharmacists and our behavioral health team and our care coaches to really look at all the things that were affecting that number in terms of diet, medication, cost prohibition to medication, right? Looking at different things that could help him to get his medications at a more affordable price. And he was really committed to being at the center of his care, like we talk about at CenterWell. And so he fully partnered, got all engaged, and he was able to bring those numbers down and lose weight.
I have the great fortune of being the Chief Health Equity Officer at Humana, and that means that I get to remind people or ask people all the time to think about what are we doing for the people that are most marginalized? What are we doing for the people that are most disenfranchised? And when you think about that work, you can easily get lost in the numbers and not necessarily think about what are the stories behind each of those numbers. Thinking about my first conversation with Mr. McCoy just makes me smile because it was one of the most joyous conversations I've had in a long time. Let me read one of the things that he said to me. When he was talking about Humana and CenterWell, he said, "They wanted to know about me physically, mentally, and socially. One of the most interesting things was that they were more concerned about me than I was. This inspired me to do whatever I can to better my health so that I could live." I mean, that is literally what it's all about. And so when we think about health equity in the context of a Mr. McCoy or a community that Mr. McCoy comes from, we think about how does his life change because we're here?
It is important to have access to places like CenterWell, to people like Miss Gail. It's important so people can have confidence that I'm not out here by myself. I know that somebody is with me and they care about me. I've never been treated like that before in my life.
Humana is thinking so much more beyond the card. That's how I think about it. You get an insurance card, yes. You get, an appointment at a clinic, yes, that's fine. But what happens after that? And I feel like when you stick your card into an ATM machine, you get something out. You only get what you have. But when you think about us, I want you to be able to use that card, use that appointment, and you get way more than what you had. You get so much more than what you ever expected. And you get an experience where you feel like people care about me as an individual more than I care about myself. And that's what it's all about.
Jerry regained his hope because you know where he was and where he is now.
I'm functioning the way I should be functioning. I know that somebody is with me and they care about me. Oh, that's awesome.